Hello, I'm Dr. Jason Moore, and today I would like to share with you some common causes and some effective treatment for lower back pain and lower back conditions. Typically, lower back pain is caused by one of two things: a major trauma or a minor trauma. An example of which would be in a major trauma such as a car wreck or a severe slip and fall at a work or anything like that. A minor trauma, an example of which would be your activities of daily living, basically stooping, bending, pulling, pushing, things around your house repetitively over a longer period of time, basically wearing your spine out over a longer period of time. Now, when your spine has a trauma occur to it, there's some things that are wrong with the anatomy is why you're hurting. There's three things that, as far as the anatomy is concerned, can happen to your lower back. One, basically the nerve being pinched on. Two, the disc is either bulged or herniated. Or three, the joint is stuck out of alignment. Now I'm going to talk about all three of these. One, the nerve being pinched on. What happens is when the injury occurs to the lower back, the vertebrae is out of alignment and basically pinches on the nerve. You can feel the pain right in the lower back, right where the area is being pinched on. You can also feel it moving into the legs at times too, because the nerves run lower into the legs, so you can feel that radiating pain into your legs. The joint problem with the lower back. What happens is the joint gets injured, it gets stuck out of alignment, it doesn't have good range of motion in the area. A part of the joint is called facets in the area, which is a real common cause of lower back pain. They basically get stuck and jammed together and don't move very well. And the disc. The disc is a round cartilage in your lower back. It has fluid in the center. It is between the vertebrae. Now when an injury occurs to these areas, what happens is the disc, the fluid, pushes against the inside of that disc, causing basically a bulge. Can be very painful. At times, if the injury is bad enough, the fluid within the disc will actually push out and break the outside of the disc, basically it being a herniated disc at that point. Now, and that can also pinch on the nerve. Some therapies that we use to treat these problems effectively in our office would be one, electric stim, which basically is a tiny little electrical soft massage on the lower back. We use a light electric current. It gets the muscles to relax, reduces inflammation in the area, helps stop your pain. Another therapy we use is called mechanical traction. We lay you on a table and a little massage roller basically comes up and helps mobile, makes the vertebrae more flexible in the area, kind of pushes against that to try and separate that space out in the vertebrae and take some pressure off of the area, thus alleviating your pain. Another therapy we use is called the chiropractic adjustment or manipulation. It's very safe and effective, doesn't hurt. What we do is we move the joint just enough, again, to mobilize it and make it more flexible, take some pressure off of the area, helping to reduce your pain. Some symptoms that you might experience with problems in the area: we're going to take care of your pain. We're going to get you out of pain as quickly as we can by using some of these modalities in conjunction or separately. We're going to get the muscles to relax in the area, and we're going to increase your mobility so you're able to do the things that you want to do and stay flexible. And if you can increase your mobility, your pain will typically go away. Now, patients' response to these treatments that we do and these modalities that we use, typically they notice that they're working better, they're able to work longer with less pain, they feel better then. Another one is they're able to sleep relatively pain-free, get a better quality of sleep throughout the night, thus without that pain bothering them at night. Another one obviously is your activities of daily living, be able to play with your kids, do your household chores for longer periods of time with less pain interfering with your life. Again, my name is Dr. Jason Moore. If you have any of these problems, please feel free to call our office at 304-523-7891, and I look forward to seeing you.